Okay, I make it 7:03, so let's kick off. Hello everyone, I'm Dr Ian Wood. I'm the RCGP First5 chair. I'd like to welcome you all to our very first GPReady event. GPReady is the Royal College of General Practitioners programme of events and content designed to help newly qualified GPs, First5s, survive and thrive in the profession. Today is simply a welcome to GPReady and general practice overall, and our panel will be offering guidance from their own First5 experience on all things GP. Putting the questions to the panel is Dr Anthony James, the AIT chair, who is very much looking forward to being in your shoes incredibly soon. We'd like this to be an interactive session if possible, so please feel free to put your questions to us, either using the hashtag GPReady on social media or write them in the Q&A section below. If we don't manage to answer your question in the session, we'll do our best to address it afterwards. So I'd like to start off by introducing our panel. We've got Amy, Alex, Anthony and Jenny with us. Do you all want to say hello and give a brief little intro about yourselves? Amy, do you want to go first?
Sure, thank you, Ian. Hi, my name's Amrita. I'm a portfolio GP. I have interest in several different aspects of wellbeing. So I have a qualification in acupuncture, I've done a diploma in occupational medicine, and I'm also studying a master's in applied positive psychology and coaching psychology. So I do that along with being a locum GP as well, and I'm a mother, so I've got two little ones, so that takes up quite a lot of my time at the moment, especially given the recent situation with homeschooling, and very glad that the children have gone back to school now, but I didn't say that. Thanks, Ian.
No, thank you for coming tonight, Amrita. Alex?
Hi, my name's Dr Alex Lai. I'm a portfolio GP in South London. I have interests in well-being, education, and I'm also recently starting a fellowship.
Thanks, Alex, and welcome.
Thanks.
So I'm Jennie Cox. I'm a salaried GP in Bristol. I was in your shoes about a year ago when I started working there. I do 3 days a week in my practice, and the rest of the time I'm generally looking after my kids and doing odd bits and bobs. I've sort of started looking into sports medicine and working with the local football team, among other bits and pieces.
Thank you, Jenny. And actually, we can hear in the background, Jenny's got some children to look after, and so do I upstairs. So if I have to hop off at any point, do apologise. Anthony?
Hi, everybody. So I'm Anthony. I'm an ST3 GP trainee working in North London, and I chair the college's AIT community. And yeah, I'm really coming up to the end of my training. I've got my final ARCP next week. Touch wood, that will all go to plan. And then I'm going to be in the same position as a lot of you on this webinar this evening, thinking about the future. So it's going to be great to hear from our panel this evening to share their insights from their career journey so far, and hopefully answer a lot of the questions that I know and I'm sure many of you have as well.
Thanks, Nancy. And just a little bit about myself as well. So I'm a GP over in Berkshire, 2 days a week, and I spend the rest of my time in a portfolio role working for some healthcare technology companies alongside this role with the First5. The RCGP. So you've got 4 members of the panel from the First5 committee. We have just joked that we're all in the south of the country. That wasn't intentional. We did have some colleagues joining us from the north of England as well, but they haven't been able to make it tonight, and they're actually doing another session elsewhere. So I should add at this point, if any of you are interested in being part of the First5 network, either locally or nationally, please do get in touch with us at rcgp.org.uk/First5. Alternatively, please do speak to your First5 representative, either at your faculty meetings or reach out to them by email. Our First5 colleagues across the UK are an absolutely invaluable support system, and hopefully you'll hear a little bit about some of the work that they've done throughout this session, I'm sure. So we're 10 minutes in, on to the questions. I'm going to hand over to Dr. Anthony James, who's going to assume the role of question master. Over to you, Anthony.
Thanks, Ian. So as I say, I'm coming up to the end of training now, and so my first thoughts immediately turn to starting a new job, finding a new role. So we've got a list of questions here. We're going to take each theme in turn, but as Ian says, if any of you have questions throughout, then do just drop them in the chat, and I'll be keeping an eye on that. But yes, getting started. So I guess lots of people will be thinking around looking for a new job, or might have just found a new job. What would you say when people are starting out that journey to think around what they need from a practice? How can they find the job that fits them? What kind of experiences have you guys had in that area? Alex?
Sure. So I CCT'd in January, so it's quite recent for me. I took on my training position and continued that into a salaried role, but I was also locuming, and then I was using locuming to try and find somewhere suitable that I wanted to join longer term. So think about what area you want to work in terms of actual practice, what kind of type of practice you want to work in, what kind of work you want to do, what the ethos is there. There's some good BMA guidance that we can put into the chat afterwards that comes up with several suggestions for questions that you might want to ask the practice about, and then thinking about how it will fit in with your life and what opportunities they provide for you in the longer term. A bit wide.
I think there are a lot of variables to think about. Everyone's going to have their own different priorities, I suppose. For some people, it's going to be about getting some income. You're trying to get that income jump up from being a trainee, and there are a lot of jobs out there which don't necessarily give you the best conditions, but do pay reasonably well. For me, it was all about finding the right team. Actually, I found I went from a VTS group that was really close knit, and really enjoyed sort of working together, seeing each other regularly. And you're changing practice a lot during VTS. And I left that VTS bubble, and actually I wanted to find a bubble like that out in the working world. So I really prioritized. I locum for about the first 6 weeks, just trying to find a practice that I looked at and thought, I could really enjoy spending time with you guys every day, no matter how much pressure is put on the practice. I'm really going to enjoy working with you and working alongside you. So for me, it's always been largely about the team, but everyone's going to have their own priorities. The flexibility. It's First 5 is a time in people's lives when you've either got more freedom or a lot less freedom, and actually some flexibility that some places can offer around sort of childcare or commuting can be really important, and that will factor in against how you weigh up things like the prices that they pay and visiting, the number of patients you see, all those kind of factors.
And can I give my perspective? So I'm a locum GP, and I'm still locuming after oh gosh, nearly 2 years of having CCT. I had to think about that then. And at the beginning, the reason I was doing that is because I wanted to amalgamate quite a lot of different portfolio roles into my profession that I wasn't able to do when I was training. And I know that training has opened up quite a lot, and there are lots of different opportunities now. But when I was training, training wasn't really like that, and it took me quite a long time to complete my training because it was interspersed with maternity leaves. And so I really wanted to make sure that I had got the future that I couldn't develop into my training life. So that was why I wanted to locum as a GP. And so when I'm locuming, I really look at practices that are able to support me as a locum. Do they mind if I ask them questions in terms of, if I have a patient that I'm worried about, is there a partner who's going to pick up the slack of that patient because I'm not going to be a full-time member of staff there? Can I hand over that to another member of staff without them being, worried about that, or without them being upset about me handing over work to them? It's all those types of questions about, what's that ethos, exactly what Ian was saying and Alex was saying, what's the culture like in that environment? How receptive are people in the environment to the questions that you're asking, to the information that you're giving them about their own patients? Because yes, while you're there as a locum, they're your patients and you're looking after them. But as a peripatetic member of the workforce, unfortunately, when you do leave, the duty of care belongs to the partners and the salaried doctors who are there. So you have to make sure that as you're leaving that practice, you've dotted all the I's, you've crossed all the T's, and any vulnerable patients are actually, looked after, and you've done all that you can for those patients. So for me, that's the kind of environment I look for when I'm locuming. What's the kind of values behind the partnership, and are they happy for me to feed back to them?
And I guess a lot of people in the call probably will have recently started a job or might be about to start a new job. Have you guys got any kind of top tips for finding your feet in those first few weeks and months? If, for example, you've either taken on a salary job or are locuming, any way that you can kind of integrate yourself as part of a team in any of those settings as easily as possible?
So firstly, have a First 5 group. Without a doubt, you need someone, in this step up to lean on, to be able to discuss things, to have someone, a comfortable space where you can ask those silly questions where you might not quite feel comfortable to be able to ask the people in your team at that point in time. And just to be able to rant a little bit about what's going on. So that's definitely a good coping strategy. But also recognize that it will be challenging, and be ready for that. And so it's okay. Like in the past month of starting my second salaried job, I've definitely felt some discomfort because it's new pathways, it's a different borough, and I know that it's going to be a bit of a challenge because it's less familiar, so it's not as easy or second nature as the place where I did my training. But yes, definitely asking for help, definitely making sure that you are feeding back to the people within the practice and letting them know, and asking. So I've asked specifically, so 1 month into the job, can we have a meeting to chat about how things are going? I've written down questions as I've gone along that I want to bring up and say, is this because of COVID that you're like this? Do you all sit in your room because you don't want to meet up? Or is this like a normal thing, in which case maybe I don't want to stay here long term? It's difficult because it is an unprecedented time, but we need to suss out these things and work out if it's the right place for us.
Definitely. And Ami, we've got a question here from Munira about locuming specifically, and asking, have you found it difficult to progress in your portfolio career, or have you been able to find practices that were supportive about that, and you were able to kind of create that portfolio jigsaw more easily because of those practices?
Yes, I would say that I haven't found it difficult to progress in my portfolio career because since CCTing, I've been given the opportunity to have full autonomy of what I do and how I do it and when I do it. And so essentially I've been making the path that I want to make. And what I would say is difficult about that is that it can be a lonely road. It can be quite difficult when there's no path ahead of you to be treading the path that is not trodden before, and to be, making your own way can be quite difficult sometimes. It's really exciting. There are great opportunities and I absolutely love it. But sometimes it can be like, oh, where am I going? What am I doing now? How am I going to get to that, that goal? Okay, how am I going to achieve that? And I think that for me is the most difficult part of it. Because as medics, we're quite used to having our training scheme aligned for us. Foundation, we know what rotations we're going to do. GP, we know where we're going to go. And then we, generally speaking, people either going to salaried roles or they locum in their practice long term. So actually, I would say no, it hasn't stopped my progression in either general practice or in my portfolio careers, because I've got a few different hats that I wear. But what I would say is that you have to be quite clear in what you want as a person, and that's the, I would suppose, rate limiting factor. But it's okay if you're not clear either, as well. If you want to change your path, that's okay as well. And what I would say is invest time in yourself, invest time in figuring out what path you want to take. You don't have to rush. No decision has to be made today. Do some good networking, do some good exploration, do some research, shadow people, get some mentors, talk to people, find out what exactly it is you want to do before you start embarking on these journeys, fully committing to these journeys, because I think that's probably what might hinder your progression if you're not fully committed to something, if that makes sense. Yeah,
definitely. I think being able to work out where it is that your passions lie and kind of post CCT is a great opportunity. If you do have the flexibility to be exploring that, is a good time to be able to do that, definitely. I guess something else is that, we are working through COVID at the minute, and the job market isn't what it was before all of this kicked off. So there might be people on the call who haven't been able to find a job yet and are still looking. Have you guys got any top tips kind of for job hunting, for, if you're looking at different places that do crop up, what are the key things that you should be looking for when those jobs are advertised, or places they can go? Alex, do you want to
go? So again, go through your first 5. So check out with your faculty, is there a WhatsApp group? Is there a Facebook group? Are they advertised there? Join your CCG email. They often advertise there for jobs. If you're locuming, there's something called, I think, 999111. locum groups, and you can find your area and then plug in, and then you'll join their WhatsApp group for local area, and then they post locum jobs there. So yeah, that's my tip.
I was going to chip in. So I locumed for about 6 weeks before taking a little bit of time off, a couple of months. We just had a baby, and then reflected on the places that I'd been locuming. And actually, there weren't many of those places that I was desperate to work longer term. And I went back to my First5 group, like Alex says, and said, all my friends who are trainees in the local area, which of you had really great practices, and can you give me a list of them? And I had about 4 or 5 pop up, and each of them I was approached sort of cold called, like, and said, look, I'm a GP locally. I know you're not advertising for a job at the moment, but I work locally, live locally, and would be really interested in coming to meet you and potentially work for you. And I had, I think the last 3 jobs that I've had in a salaried role have all come through that way. This is not for an advertised role in any way. This is just me reaching out to them. And actually, I really value that, because there have been really good teams I've been involved in. And the one I'm in now was purely from recommendation, and they weren't looking for a GP, but actually they want it, the timing is right for them to open up a little bit. And it's been the best decision I've made, really, joining this practice that way. I haven't always gone out looking for jobs on recruitment boards. And I'm like, and don't be afraid to use those networks. I don't think many GPs mind an inbound email that says, hey, look, I'm a local GP, I train locally, working locally, and I'd like to come and meet you.
And we have got a question here about someone who is currently applying for jobs and has been using like NHS jobs to apply for things. I don't know if you guys have any experience of using NHS jobs for applications, but they're basically asking, what's kind of the standard in terms of hearing a reply? Do most practices get back to you even if you haven't been successful? Do people not get back to you? Do you guys have any experience there at all?
Yeah, I mean, I haven't applied for a GP job on NHS jobs, but you should get like a confirmation that says that your application has been received. So if you haven't received that confirmation, then check just in your junk, or resubmit your application just to confirm that your application has been received by the practice. But I would expect that you would receive a reply post the application period end, because they would have to wait for all the applicants to be received, or the applications to be received, before they kind of go through their selection process. That would be my understanding, so that it's a fair and equal process for all those applying.
Yeah, and I guess if you haven't heard and you're concerned, you can always find out you can just look at the practice's contact details, drop a line to the practice manager. I'm sure they'll get back to you one way or another. It's probably a good way to go about it as well. The other big thing that people do start to think about, obviously at this juncture, is money and indemnity and everything that goes along with that. People often talk around things about like getting an accountant. Is that something that you guys have done or feel like it's necessary to do? Have you got any experiences there at all?
We slightly joked about a question that this might come up before the panel started, and I don't think anyone here is super hot on the medical accountant, but certainly for me, look, I'm very much in a portfolio role at the moment, and I need an accountant to keep track of the different ways different people pay, and I've accepted that. Looking at, on reflection, most people say that you can have an accountant for a year or two, see what they do, and then you can go away and do it yourself, just copying the template, if you like, which churns out. But I very much needed one in my portfolio role. But when I started out as a locum, I felt quite comfortable doing a self-assessment tax return. I must be honest, there's one thing the government really is getting right at the moment. HMRC are fantastic at walking you through that process, as long as it's a simple role that you have, one locum role, maybe a salary role alongside that. It's relatively simple, but it got a little more complicated in some portfolio roles. I don't know what the rest of the panels might know, sort of.
Yeah. I was in a relatively similar situation to Ian, where I wasn't needing an accountant, but actually I just had a conversation with my other half today, where I was saying actually now's the time where I need to kind of look for a proper medical accountant. My husband is an accountant, so he can advise me on how to do the self-assessment. He's not a medical accountant, so I think anybody who has a portfolio role or who is working as a self-employed doctor probably would need to get advice from people who understand the medical pension scheme as well. So that would be my advice. So I'm looking as well. So if anyone does know anyone and you want to let me know, I'm also looking.
And I happen to, I actually found an accountant last week. So I in my portfolio role, because I work for the LMC and I work for HEE, and then I have my 2 salaried roles, I got this tax bill that had changed all my tax codes because it counts as my 3rd job, and they've split the tax across. So recommendations are, you can sign up for self-tax assessment online and see the explanation of your income and your tax code. You can call the tax office relatively easily and talk it through. And then there is also no harm in having a look into some of the companies and having a free assessment or talk with them about your needs and whether or not you might need an assessment or an accountant. If you're just doing a salaried role, then as Ian said, you can probably fill it in yourself, although some of them charge maybe a couple of $100 to do it for you. And so it depends on, you know, if you listen to Claire Gerarda's talks, whether it's worth your time stressing about it, or if it's just worth, you know, one of your sessions, paying that money, and that's you done for the year by someone else, so that you have the time to enjoy or spend with your kids.
I would add that I've gone straight into a salaried job, and effectively that is staying on PAYE. I didn't need an accountant at that point. Now I'm starting to branch out and, as I said, working with a local football group. That is going to be a second income stream. So I'm very much at the beginning of that story, but I didn't need that at CCT point. So there's nothing to panic about. If you're just going to have one role, it doesn't need to be part of this stress, if that makes sense.
Just to pick up on that as well, Jenny, actually most practices, the partners will have their own accountants that they use, and actually a lot of them you can sometimes negotiate that into your contract. Well, actually, can you include me in your practice accounting, and that might save you the £500 or £600 it costs you to do an accountant's tax return. So I'm sure there'll be some questions in a minute about, you know, what we look for kind of in packages, but actually having an accountant included is a possibility for a lot of people.
Yeah, and I kind of on a similar tone to that, there's a question around indemnity, and I know it's something that people often have some questions about. We obviously have the state-backed scheme now, but particularly for people who are locuming, obviously having additional coverage is really important, and even if you're working in a salaried job, having the additional cover is important. So do you guys have any kind of tips on which people you'd recommend, or how best to kind of start thinking about what you need to do indemnity-wise post-CCT? Ian, yeah?
I really want to start here because it's a bit of a bugbear for me, and I'm an overly cautious person, so it might come through in this statement. But it's really important very early on, especially if you're building a portfolio role, to remember that you're often being employed as a GP for other roles, even if it's not clinically facing roles. So like I said, I work for 2 healthcare technology companies, but they employ me because of my GP experience and for clinical opinions, clinical input into what we're producing. And it's so important to be fully transparent with the indemnity groups that you're approaching about what your roles are, and make sure it's a recorded conversation. And I've even on times asked them to email back, you know, in the statement detailing what my roles are and what they're covering me for. Because all the horror stories I do hear around indemnity are where people haven't had a full or a transparent discussion about what they're doing. Well, like Jenny said, working for a football club. Well, that really is something which a lot of people have to pay extra for indemnity, and they don't think about it. I think it's another session, but it's not just another session. You've got to make sure that you're really wholly transparent about what you're doing. And actually, indemnity for a lot of these roles, especially the non-clinical facing roles, is not very high. And for me, it's worth that little bit extra investment for that peace of mind that should anything come back to bite me in 20 years' time, I know I can rely on the paper trail I set up with the indemnifiers at this point.
The other thing is, when you get your indemnity paid back by your practice for those salaried roles, check your pay slips, because often they'll forget for a couple of months and then you have to chase it up and get them to back pay.
It can be worth thinking about whether your practice is happy to do that and reimburse you as well, or whether they want to bring you onto a practice-wide scheme where they're sort of bulk buying their indemnity. Now that might not be with a provider that you're happy with, so just make sure you've done your own research about that before you accept, oh yes, we're all on MDU, so you don't need your MPS anymore type thing.
Yeah. And just actually to expand on that, there are a lot of roles that we feel in practice in GP which aren't covered by a state-backed indemnity scheme, and it's really important to make sure that your job description and the things that you're doing are covered. So example of things like CREM forms, DVLA forms, or fitness to fly. People do those notes, or it's run marathons, and there's quite a long list of things which aren't covered in a state-backed indemnity, and it's really important that if you're perhaps going to be expecting you to do those work, that either they put the bill for that, or that you're happy to pay the extra indemnity costs that go alongside those bits of work.
Yeah. And Ami, just in terms of from a locum point of view, any additional tips that you'd give for people when they're thinking about indemnity, or have we covered everything, do you think?
I think everything's been covered quite comprehensively, but I would say, just to echo what Ian said, really make sure that you're talking to the indemnity providers about what each role that you're conducting really is. Be really transparent about it, whether it's a clinical role, even though you are a doctor, even though you do have a clinical role, if it's not clinical, interfacing in that particular remit in another sphere, just, really do make it clear. And as Ian said, I'm kind of a stickler for the rules as well. Get a recorded conversation, get them to email you back on that day, and if they don't, chase it up, because things do get lost in the post, lost in the ether, and people don't get back to you. So please just be mindful of your own processes now. I think as you move into kind of independent practice, it's really important to just be mindful of your own legalities and forms and things like that.
Definitely. Something else that obviously is a really common thing that people have a lot of questions about, something I've definitely started to think about, is obviously ePortfolio doesn't end when you CCT, and starting to think about appraisal and what that really means. I know that a few of you have probably already, you've been through cycles of appraisal already. What would be your top tips for me, who's pretty clueless about the whole thing? What should I be doing now? What do I need to prepare over the next few months?
I think the first thing really in a lot of ways is to make sure you've got an idea of which of the providers that you want to go with for your portfolio for appraisal. There's a lot of different options out there. I believe you can still do it on paper if you're that way inclined. I think most people go either with Clarity or 14 Fish. Certainly locally, they seem to be the two big front runners. But have a poke around them, see which works best for how your brain works. Certainly the old RCGP trainee portfolio didn't always work in the same way my head wanted it to work. So sorry about that. So, having a look and working out which one's going to be more user-friendly for you. They are much of a muchness, but you don't want to be fighting against the technology that's meant to be there to make it easier.
And is anyone going to be brave enough to try and unpick the new appraisal? Because I'm not sure I can say it confidently enough, but it's certainly changed. Yes, Alex has got his hand up. Brilliant.
So only because I attended a webinar last week on this, but basically appraisals were stalled for a period for a number of people, and there have been a lot of revamps of the appraisal to recognize the difficulty that COVID has brought. So they are moving towards a much more compassionate appraisal that is focused on well-being. So for the coming months, the appraisal is less to do about CPD, and the only thing over the next year that they will be needing or requiring is any complaints or compliments and any significant events. So not you've prescribed something wrong at your GP practice, but things, she said, that have been escalated up to NHS England. Other than that, in terms of documenting your CPD, with 14 Fish, you can do it without having to pay anything, and you can just sign up and then start plugging it in and just save it there until the time comes for your appraisal. In terms of getting your appraiser, please be patient with them. They have a massive backlog, and they will get in touch and they will find you an appraiser. And really, they're moving away from this whole 50 hours of CPD and trying to focus more on you reflecting in the way that you have done during GP training on, how has this affected you? What have you thought about this, and how have you handled it, and what have you done to change it, or what do you think moving forwards? And that was the recommendations from the webinar from Fazana Hussain, who is an appraiser.
Certainly for me, I didn't, and there's a question in the Q&A about this, about when they, which I think you've just answering, but my appraiser reached out to me. I didn't make contact with the everybody myself. I had an email about 6 months into my first year saying your appraisal's coming up, here's the name of them, and they reached out to me. And probably not the same everywhere, but I think that standard email does come out to everybody, so don't worry, they will find you. I think if you've gone a few years without having one, it might be worth chasing them, but I haven't heard of anyone being missed off. I think we were doing 50 hours of CPD a year, as Alex just said. I think I read in the emails that came out that they're estimating now that to prepare for your appraisal, you're looking at 30 minutes max to prepare for it, which is quite a shift really from the 50 hours before. That's very welcome, and that's really been driven by acknowledging the fact that most of our focus has been on the clinical care delivery during COVID, and we've made 34 minutes without saying the word COVID. I think I'm the first one to mention it. I'm sorry.
I mean, that is good to hear. And I guess in terms of, it sounds like there are potential further changes or additional guidance that's going to be coming out. So I can presume that the RCGP website is a good place to keep up to date with this stuff as well.
I think, Anthony, if I could just add to that, we are we're always wanting to make changes to appraisal. So I think it really is a work in progress. And I think we're using this current time as a springboard to really try to instigate that change and really try to pivot from that. So I would say watch this space ... Although, you know, I think that I'm not involved in the more, you know, organisational aspects of that, if you see what I mean, the more strategic aspects of that, but there's definitely work going on and there have been discussions going on.
Mm-hmm. Something that, you know, a question just popped into the chat around finding additional roles alongside your main clinical duties and how you've all developed kind of your portfolio careers. And obviously we've spoken around taking those first steps into a new clinical role, but each of you have done a variety of other things as well. Were those interests that you developed throughout training or since? Are there any tips you've got for helping people to navigate those additional opportunities that exist, find the things that really they're passionate about or that they might be interested in developing a career based around as well?
Does anyone want to go first?
You go first.
You're up, Hammy.
Okay, so I would say that my main advice would be is to take your time, and I know it sounds like a bit of a cop-out, but really I would really explore all the different opportunities that come to you. So you might think I'm really you know, interested in this aspect of clinical medicine, but actually what is it behind that thought that makes you interested in it? And I know that sounds like a really tricky question to answer, but really doing some work on yourself, really doing some work on why have you made this journey, why have you come this far, why are you doing what you do at the moment, they're really important questions to ask yourself. And I think when you're in the full throes of training, we just don't have that headspace to ask ourselves that question. Like you said, Anthony, you're just, you know, you've got your ARCP next week. And I think when we're going through all these really important milestones, we just want to get through those next hurdles. And I think actually having this opportunity post-CCT gives you that breather, it gives you that headspace to really think, what do I like? What do I enjoy? Why did I do this in the first place? And for me, yes, I became a GP because I love people, I love connecting with people, but it was so much more than that. And so I just started networking with people, I started connecting with people, and I literally met about 200 people, and I researched about 70 different master's subjects before I embarked on the current master's that I'm doing. And it took me about 9 months to decide that. And so that's why I'm just trying to support you all in that decision, that actually if you want to go down further education lines, if you want to go down entrepreneurial lines like Ian has, if you want to go down holistic well-being lines like Alex does, really research that and really put your heart and soul into figuring out what it is that attracts you to that specific role, what attracts you to that specific sphere, because that will give you more of an understanding as to the driving force behind that, and that will make things a bit more clear to you. It'll give you that intention behind that. Don't be afraid to reach out to people, have the courage to reach out. People want to help you. If you don't know somebody, ask somebody, you know, to connect you to somebody else, you know, network with people. learn from people, talk to people, ask questions, be curious, ask if you can shadow people. And I know that at this current moment that's really difficult, but if people are providing services via Zoom, maybe you could join a Zoom meeting. Maybe they could have, you know, if they're having like a board meeting or something, they might have a mentee come along with them. So it really is about having the courage to take that first step and create those opportunities for yourself. So I would say that's my advice.
And yeah, I think that's brilliant advice. Ian or Alex, I know that you're unmuted. Do you want to say something?
Fantastic answer, Amy. I think I was just going to add, you know, have a think about what kind of career you want. You know, how do you want your week to look, and then how can you get your passions and interests integrated into general practice. Definitely, as Amy said, reach out to people. You know, we live in the age of social media and through your faculties, and there are so many people doing all of these different interesting portfolio careers. So if you see something that you like the look of, that sounds like something you'd be interested in, reach out, ask how they got there, what was their path there. And then things have always changed, and there are always opportunities that are advertised. Check out some of the webinars. There's plenty that go backwards as well that you can have a look at.
I suppose I don't want to give very similar answers to what Amy said, but it's, you know, very wise words. I'm sure in a minute it'd be good to put the same question to Jenny with your football work as well, because that's probably of all of us, you're the one who's doing the more, you know, clinical application, but outside of the four walls of general practice. So it's come to a minute. I suppose for me, getting into my roles, it was very organic. I found something which I really enjoyed doing, and I was doing it anyway. And I was doing it a lot. So that was just, you know, using the clinical systems that we've got to make, you know, just improve the care that we're delivering locally. And that just grew. It grew from a practice to a what were they before PCI localities, and then grew up to CCGs, and then just became national. So it's for me, it was doing something I was enjoying doing. I wasn't expecting to be paid, never expected to be a living, and it just grew. And now it has become a really core part of my working week, which I really love, and I get to make decisions which impact, you know, the 55% of the population. Is fantastic, and it's I was just very happy to do that, whether it was a career or not, at a very local level. That was the key bit for me. But Jenny, have you got any words really about, you know, clinical roles outside of the four walls of general practice? I think there'll be a lot of people probably quite interested in that.
Yeah, I mean, I have really sort of fallen into working with football. I work with Bristol City women's team, which is slightly different from the Premier League. We have a lot less money involved, but yes, keeping the day job. It kind of grew from my pre-GP career, because I had a hospital career before I came out into primary care. And I was working in orthopedics, so the kind of sports medicine injury side of things has sort of led me down this particular route, and it was sort of a thought of, did I want to do more along the long-term, slightly more GP-ish side of musculoskeletal stuff, or did I want to sort of channel myself down the minor ops side of keeping that skill set. This is what's come together at the moment, and I'm really enjoying it. It's certainly not something that I foresaw me doing when I was in med school, for example. I think from a sort of organisational, how did I get myself into it point of view, I was reasonably vocal that was one of my thoughts of what I wanted to do when I was going out for interviews, when I was dropping CVs off at practices, fairly similar to you, Ian, as I came towards the end of my ST3 year. And the practice that I've ended up working in, the senior partner was doing this role when I arrived. And he sort of mentored me through last season, much as it was, and this season I've kind of taken over that role a bit more officially, although he's still around for questions, queries, panics, and anything that's not COVID swabs, please. Which has been the majority of it so far. It's not been as glamorous and musculoskeletal as you might have thought. Yeah, that's kind of how I've ended up in that. I am still networking, putting out little feelers as to what sort of opportunities might be out there to bring the sort of more surgical side of the skill set back into the portfolio, but that's, with everything that's going on with COVID, that's on a bit of a back burner at the moment.
That's really great. And I think you know, a word that I often think about when I think about people, the roles that people end up finding themselves in, is like serendipity. Like there's definitely a bit of luck and being in the right place at the right time, plus having obviously like a certain drive or a passion, and things do tend to align. So I think, as Amy said, there's no rush around any of this, and it is, you know, you guys have the rest of your careers ahead of you, we all do, just to kind of further those passions, learn what really motivates us, and find those roles which really help us to find our flow and our kind of happiness in our careers. So I think it's really nice to hear the different journeys that you've all been on at still like a really early stage of your careers. It's really great, and it just shows the massive opportunities that we've all got open to us when we finish training. A question has come up, and we did have a chat about this before. We won't talk around this too much, but it is about pay, so particularly for kind of salary GP pay. It's asking about average pay scales. Obviously, there are like figures around the average pay for salary GPs in the UK, and I think it's fair to say, and you guys can jump in here at any point, but the rates around the country do vary from place to place. Bigger cities, you might be able to attract a bit of a higher wage than other places. It's, you know, it does vary. I think it's good to speak to people probably in your local area around what kind of you should be expecting in terms of the pay rates there. And I guess also there's a certain element of negotiation in anything, and as part of GPReady we have got a load of really good masterclasses that we've put together, which are kind of 15 to 20-minute videos. One of those is all around negotiating skills with Dr. Serena Chibber, which you can check out on the RCGP YouTube channel. But on pay, did you guys have any other points that you'd just like to drop in, or advice for people who are taking on salaried or other roles? Jenny? Yeah?
I would say that it is so variable. I'm in Bristol. I did my training actually down in Taunton. So really rural areas within our patch, and also really quite urban with Bristol and Bath. It's actually some of the more rural areas that seem to be attracting the higher pay. Whether that is because with Bristol Uni, people are wanting to stay in Bristol once they're in Bristol to live, and therefore there's a sort of commuting distance that people are happy to do, which keeps the prices down. I suspect that that's part of the case. I don't know that it's entirely the issue, but certainly some of our rural areas are more willing to pay more than our urban practices. I don't know if that's the case in London or anywhere else. It may be different, but that's certainly what we're seeing here.
I'd certainly echo that, what you said, Jenny. I think that's quite representative of most areas in the country. From what I've heard, certainly in London, the kind of areas in Kent, I think, attract a higher salary than South East London.
Yeah, so I guess ask locally what's happening. Again, it's another great illustration of why it's good to have those local networks through your First5s and your colleagues who you might have been through VTS or other networks with. So yeah, but I guess the main thing is there is a huge amount of variability around the UK, and also in the type of role that you might take on. I think, as Ian might have said earlier, this might have been before we started talking on the webinar, but some roles might have a bit less favourable conditions. They might get paid a bit more. So I guess some of it is also balancing up what kind of role that you want to take on, and finding something that meets both your financial and your career kind of aims as well. Another really important thing that we do need to talk about is well-being, and obviously the transition from trainee to post-CCT independently practicing GP is a big one. Through training, we've had our supportive VTS there, we've been in a more protected environment, and so I think the challenge of adapting to working independently probably can come as quite a shock to the system sometimes. If people did start to feel a lack of motivation, or did feel that they were struggling a bit. Do you guys have any tips for kind of getting support, finding those networks if you're not part of something, if you might have moved area? Just any tips for kind of people who are struggling or facing any challenges throughout the early part of their career?
I'm just going to echo Alex's point earlier about First5, and then I'm going to hand over to Alex and Amy because they're experts in the world of wellbeing and looking after themselves. So, but First5 networks, First5 groups really should be they could be on your new VTS and a way of finding support with each other locally.
Yeah, going along the lines of that. So having community and having a group of GPs who you can connect with, that you are able to discuss any issues you're having. Obviously making sure that you're being honest about both what's going on at work, especially given the current situation, but honest with yourself about what you can manage and what workload you can manage, and being honest with your work colleagues if you're finding that a struggle. It is a step up. It is recognizing, your own level of burnout, and watching out for those warning signs when you're getting frustrated or losing that compassion. For anyone who is really struggling, of course, it's completely understandable, and we know that 1 in 3 GPs suffer from burnout. There is the practitioner health, and make sure that you are being open with whether it's your friends or your partner or the people that you work with. I'll hand over to Amy.
Thanks. So I would just like to echo exactly what Ian and Alex have just really eloquently stated. But another part of that for me is really giving ourselves the resources before any of that happens. So we can't prevent ourselves from getting into situations that are difficult. This is life, and some of us are more vulnerable than others. And it's about how we can, one, acknowledge that in ourselves, 2, manage those emotions, and then 3, act on them. So before we even get to the point of acknowledging them, when we're in a healthy state, when we're in a healthy mode, we can really work on our mechanisms to support ourselves and give ourselves the greatest opportunity to be able to strengthen the resources that we have. So by that, I mean, really, really think about the connections that we have with people. So Ian's mentioned it, Alex has mentioned it, and Jenny mentioned it before, but work on, really building up those relationships with people. And I don't mean in terms of number, I mean in terms of value. So if you have a great relationship with your mum, your dog, your brother, your sister, your partner, whoever it is, really focus on those, because it's those relationships that are going to really support you in your time of difficulty. And when you strengthen those bonds with people, you can really rely on them, and you can really show your vulnerability with people when you need it. So that would be my first piece of advice. When times are good, lean on people, because when times are bad, that will become second nature to you. You don't have to think about it. And we want all these mechanisms to be just like riding a bike, just like writing, just like driving a car. If you can do all those things, I'm sorry, I'm talking about skills that people might not be able to do, because my son can't ride a bike yet, so I was just thinking that. So, just think things like, that normally come naturally to some people. So, you want things to come naturally to you. So really work on them in your good times so that they become second nature. The second thing I would say is love yourself. And I know that sounds really, really wishy-washy, but really the art of self-compassion is really, really huge. And that makes us better people to ourselves. It makes us better people to those around us, and it makes us better doctors as well, because we can convey that sense of empathic resonance to other people. So that will prevent us from feeling burnout. And I don't mean that, we don't want people to be feeling burnout. If you do, that's not a weakness. Please don't feel that that's a weakness at all, but we don't want people to be getting to that point, because it's much more difficult to repair the situation at that point. So it's all about reparative and restorative measures before we get to that thing. So, I could talk about this for ages, so I won't, but I just wanted to say that, really invest in yourself, because investing in yourself isn't selfish. Actually, it's protective for you, for your loved ones, and for your patients as well. So, just take time to learn to love yourself, because it's not a skill that we do very easily as doctors, because I don't think we necessarily have the time to do it. So that would be my word of advice.
Absolutely amazing advice, Emily. But there's been a question in the chat as well about mentoring as well, and I think that's a really good one to pick up here, actually, in terms of probably, like Emily just said, actually finding someone who you really can lean on in the good and the bad times. And there are lots of local schemes for mentoring, and it does vary hugely. I think my local one in Thames Valley Patch was provided by HEE for a while, and I don't know how people have got experience other ones locally, but what's a really good scheme that's coming out soon, we're hoping is sometime around Christmas this year, is RCGP is launching its own mentoring program. You know, at a very high level, it's a platform for members of all grades to pick up either being a mentor or a mentee, and that might be a retired GP partner, it might be an officer of the college, it could be anyone, but actually it's someone for you just to get experience from, and also to bounce the thoughts, the emotions, the ideas that are going on in your mind against someone who undoubtedly would have had very similar dilemmas or successes at different points in their career as well. So that's coming sometime later in this year, and when it does happen, there'll be a big song and dance from the college about it, so that everyone hears about it, I hope.
Thanks, Ian. Yeah, I'm really looking forward to that. I think it's going to be a great resource for everybody to access. And the other thing that I would say was amazing advice, Ami, as always. And Ami has a few different wellbeing coaching videos which are going to be coming out throughout GPReady as well. So again, keep an eye on the RCGP YouTube channel, which is where you'll be able to find those as well for some more really great insights from Ami. We are coming up to 8 o'clock. The final main question that we had on our suggested questions list was around forward planning and what age should I plan to retire. We probably don't have time to address this now, and I don't know if you guys have really thought much about it. As a first five, what are your thoughts on when a GP should retire? Personally, I was thinking 35. I've got a few more years left in me, guys.
I'm a cynic, so if you stay with the NHS, then by the time we get there with successive governments, it'll be age 78. So have a backup plan is what I would say.
I think for me, look, I try and take a long-term view for lots of these things, and we all have some really bad days in general practice from time to time. But actually, when I can reflect back on my year and say, you know what, the majority of my work I haven't enjoyed this year, that's a sign for me that I need to change things about doing something different. That might not be retiring, but it might be moving away from profession. I hope that never happens. I hope I'm working till I'm 78 alongside Alex. But for me, I just try and take a long-term view on looking at those bad days with a little bit of perspective.
Well, if I was going by Anthony's rule, I would have retired a few years ago now. So I think I should quit while I'm ahead, essentially. But I would say, do you know what? I genuinely haven't thought about retirement, and not as in terms of the age. And the reason I say that is because I really love all the things I do now, and I haven't felt like. So, you know, I mentioned before that my training took a really long time. And so now I'm in this phase where I have all this autonomy. And so I'm really, really enjoying everything I do. And so because I have so much passion that surrounds my job, I really, really love it. So to me, retirement is way over there in that direction. So I haven't, it's not on my radar at the moment. So I'm sorry, I can't answer that question.
And it's also something that other people in other careers take for granted. We really do have purpose and meaning to the stuff we do. So if you retire, then you're just bored, and you might not have that passion and purpose and joy that you get from the stuff you do.
Yeah, and I think the other thing is that particularly throughout COVID, we've seen lots of kind of previously retired GPs come back into the workforce, not necessarily even doing clinical work, but getting back into mentoring or other opportunities. So I think the general practice really does set you up for being able to continue to be active and engaged in a really amazing profession for the rest of your life, I guess, which is a really nice thing about it, is a profession where we see all ages and people at all stages of life, but also something which can be a part of us throughout our lives and all of the ups and downs that we will face as well. So we are 1 minute away from 8 o'clock. Thank you so much, guys, for sharing some really valuable insights. I definitely feel that I'm coming away with a lot of really valuable information from the last hour. So thank you for sharing so openly and honestly about all of the questions we've touched. And I hope everybody else who's been joining us has appreciated that as well. And I think Ian is going to finish off for the evening with a few words.
Well, yeah, to share, I mean, it's similar to what you just said, Anthony, but yeah, thank you all for coming. And thank you also to the 3 other panel members tonight. Don't forget to access some of the other really great GPReady content that Anthony's already mentioned, and there'll be plenty more as well. You can either search that on hashtag social media GPReady or head to rcgp.org.uk/GPReady. And you can also sign up for our next webinar as well on the future of general practice, which will be next Tuesday. We'd also really appreciate some feedback to make sure that these events can be as engaging and as useful as possible. So please, when coming off this webinar, you should be taking a really short survey where you can share your thoughts about what you've enjoyed and what you'd like to see added in the future. So please do just take a few minutes to do that. But that's all from me. So from Anthony, the panel, and myself, thanks a lot for coming, and I hope you enjoy the rest of your evening.
Thanks everyone, bye.
Bye.